Anaplasma, Babesia, Bartonella, Mycoplasma fermentans, Rocky Mountain spotted fever, Q fever, adrenal dysfunction, hypothalamic pituitary abnormalities, heavy metal toxicities, they can't get to sleep, they're depressed, and have elevated cytokine levels. That's pretty much the patient who comes to me.
Thanks for summing it up.
And you will not find that in the medical literature, that type of case presentation, which is why it explains why a lot of these double-blind studies will not show with 30 days of Rocephin followed by a couple of months of doxy why these patients don't get better, because they don't address all of the different things that go wrong in patients' body when they have chronic Lyme disease. So chronic Lyme disease is a symptom complex of these multiple co-infections. Anaplasma, Ehrlichia, Babesia, Bartonella, Mycoplasma, rickettsial infections, viruses, they're all now widespread in ticks, and I'll show you the scientific literature on that. We know that these multiple co-infections may suppress the immune system. They can also lead to a non-specific stimulation of the immune system. This is basically in part by these blebs that are secreted from the organism's surface, where the DNA goes inside the cell, and it makes it a host target for the immune system. So that can lead to inflammation, where we get a lot of cytokines like IL-1, IL-6, TNF-alpha, immune dysfunction with false positive AMAs and rheumatoid factors. When you treat these patients, and they didn't have rheumatoid arthritis or lupus, the rheumatoid factors and AMAs reverse back to normal with treatment simply for their infections and for their co-infections. And a lot of these patients also have autonomic nervous system dysfunction. Now, Dr. Krause had published in JAMA in 1996 on Lyme and Babesia, where he found that spirochetal DNA was found inside the blood 3 times more frequently when they had Lyme and Babesia together. And we're going to address this today, that when you get these multiple co-infections, it basically suppresses the immune system. Many co-infections persist despite seemingly adequate courses of antibiotics, and we're going to show that because in my practice I've had positive PCRs for people with Lyme, Babesia, Bartonella, and Mycoplasma. And I'm talking after over a year of antibiotics, these PCRs can be positive in the blood and in the urine. We also know that these bugs can be transmitted transplacentally. There was just an article that got published by Dr. Breischweit in the Journal of Clinical Microbiology that they're now finding Bartonella insulae being transmitted from the mother to the fetus. This is also another one of those co-infections now that's transmitted, and I'll show you some of the science on that. And the definition that I would like to put forth today, and this is something we're going to address this weekend for ILADS, is how do you really define chronic Lyme disease? What is chronic Lyme disease? The definition that I've been using in my practice, which I think explains it, at least from my perspective, is MCIDS, MCIDS, multiple chronic infectious disease syndrome. This would better define the patients who have chronic Borrelia. They have all of these co-infections. They suffer from chronic fatigue, myalgias, arthralgias, neuropathy, and all of these neuropsychiatric manifestations. These patients have multiple overlapping etiologies which are responsible for their symptoms. So there's a map that I generally give out to the preceptors when they come